Hello, everyone. The BMM Youth Team is ecstatic to bring you the seventh installment of the My American Journey series, where we interview American Marathi working professionals from a variety of different fields. On today's episode, we have Dr. Prabhav, Dr. Hersh Bendre, and Dr. Sanjana Salwi, talented physicians spanning many different specialties, and you'll definitely want to hear about their incredible American journey. My name is Amol Shirodkar. I'm a sophomore engineering student at Rutgers, and doctors, thank you for taking the time to do this interview.
Problem.
To start off, could everyone please introduce themselves?
So my name is Prabhav. Some of my friends call me Prabhav sometimes. I am a physical medicine rehabilitation physician. Sort of to start from the beginning, I did undergrad at Johns Hopkins. I took a year off, did some research at Rutgers. I did medical school at Rutgers, New Jersey Medical School. And now I'm doing my PM&R, physical medicine rehabilitation residency at Northwestern. And I'll be doing a fellowship in interventional spine and musculoskeletal medicine at the Hospital for Special Surgery in New York.
Hi, everyone. I'm Hersh Bendre. I'm currently a resident in urology. Going back to the beginning, I first did undergrad in biomedical engineering at Boston University. I then did a kind of pathway or early acceptance program into the Boston University School of Medicine, and which was an 8-year total program, including undergrad. And then now I'm pursuing a urology residency at the Massachusetts General Hospital in Boston, where doing surgery on kidneys, bladders, prostates, all of the urinary tract. And I'm currently in my 3rd year out of 5 in that.
Hey everyone, I'm Sanjana Salwi. I'm currently a neurosurgery resident. I went to undergrad at Columbia and majored in biology, and then I did medical school at Vanderbilt in Nashville, and now I'm a first-year resident at University of Penn in Philadelphia.
So to start off, Prabho, did you know what you wanted to do when you were in high school?
Not entirely. I think in high school I went to like an engineering type high school. So a lot of my bias and studies and subjects that I took were more engineering focused. That kind of helped me because I realized maybe I wasn't the biggest fan of engineering, and that kind of helped direct me towards the medical sciences more. So kind of by the end of high school, I had the idea that I might think about medicine, but I don't think it crystallized into a full career until I got into like the middle part of college.
Very interesting. So Hersh, what role, if any, did your parents play in your decision to pursue a particular career or field?
I think they definitely had some influence on it. I think growing up, was always kind of science oriented, and like many Indian parents, I was always informed that engineering or medicine are good fields with good and reliable jobs. And not that they necessarily pushed me towards medicine, but I think I saw aspects of their careers as engineers and found that I wanted to do something a little bit differently. And so I think just seeing their careers helped me realize that medicine was something I found interesting. It was more sort of interactive with people, helping people. And that's kind of what led me. That was the influence that they had on me.
So now moving on to your college careers, opening this question up to everyone, did you take a gap year? And if so, why?
I did take a gap year. The initial reason for me taking it was really about logistics. I decided I wanted to go into medicine late in college, and by the time I had finished my prereqs, I needed 1 more year to kind of finish up my materials and start applying. But my gap year was one of the best years of my life, and I definitely recommend it. especially if you were like me and you weren't sure going into undergrad and you needed some additional time to explore. I think it's a great way to make sure that you want to do medicine. I worked as a medical assistant and had, daily patient interaction, and it was such a solidifying experience to know that I actually wanted to work with patients. So I can't recommend that enough. So just take one more year, make sure it's what you want to do, because it'll be what you do for the rest of your life. And then I think it also gave me a lot of maturity to have my own apartment and learn how to do that part of life as well. That was extremely helpful later on going into medical school to have that experience. So would recommend. And it was very fun, which is, you learn to cherish those years later on.
Yeah, I echo all of that. I also took a gap year kind of for similar logistic reasons. I kind of wanted my last semester's grades to be on the transcript that my medical school would see. There were still some other projects I was finishing up. And I just wanted to kind of strengthen my overall application before I applied to medical school. So I took the gap year. I lived at home actually for that year, which was nice. I got to spend some more time with family, got to see my friends more. I had a lot of fun that year. I worked at a lab at Rutgers, doing some research, and I also had some time at the end of the year to travel. So totally agree. Would definitely advocate for a gap year for a number of reasons, either logistic or personal.
That's great to hear. So what extracurricular activities did you participate in college, and how did these affect your future career?
So in college, my main extracurricular activity was probably research related. I was doing really interesting work on tissue engineering in this biomedical engineering research lab. I also did some volunteering activities around the city. And then other than that, I played intramural sports. I think overall, what was sort of most important about the extracurricular activities was that it was something that I found engaging and interesting, and it helped me sort of, in some ways, confirm that I liked the field I was going into. I liked medical related things. I liked working and helping with people through the volunteer organizations. And eventually, when it came to medical school applications, that sort of interest is something that was easier to convey because it was genuine. And just having something to talk about that you're passionate about is overall more important than like any particular thing that you're doing just to check a box. So that's what I found with extracurricular activities.
On the topic of medical school applications, and this question is open to everyone, do you guys have any general advice for applying to medical schools?
I could start with that one. In terms of preparing your application, I definitely agree with what Hersh said. I think medical schools want to see people who are passionate about medicine, people who are passionate about helping people. And I think if you have had meaningful experiences in undergrad, maybe even high school, that can convey that, I think that can really help your application. So I think it's important to have those experiences. Do clinical research if that's interesting to you, do some volunteering, work with patients and kind of see what that's like. And then in terms of the application itself, probably applying broadly. It's probably getting more and more competitive every year. It's been a little bit of time since I applied, but I hear it's getting even more competitive than it was when I applied. So I think, trying to break up into seeing where you fall competitively and then applying for schools that are like right in your sort of applicant pool, maybe some reach schools and maybe some schools that you're not necessarily crazy about, but still you'd be happy to go there and get into medical school.
I can chime in also. I think just to add on to that, kind of I think we all here decided in college that we wanted to go into medicine. It's important sort of early in college to explore and figure out that it is right for you. Once you do figure it out, I know the application process can be a bit stressful, but basically just having a very kind of planned approach to it, I think is important. There's a number of things you need to do for it, and just, being methodical about it, and keeping a checklist and just taking care of things as you go will just keep you organized and focused, and will make the process a little less stressful.
Yeah, I agree with everything that Hersh and Prabhav said. I think the only thing I would add to that is things that, when we look at application, things that I think stand out are people that have really excellent letters from people that know them well and have worked with them for a long time. So I would try to form those relationships with people as early as you can, so you know that who's going to be your letter writer, and have those discussions with them so they can write you a more personal letter. And then I think something that's strong is, like they said as well, is having like patient interactions, because I think one thing people want to know is, do you actually know what it's like to be a doctor and what that day-to-day is, and what that day-to-day is, so that they know that you're not going to come to medical school and then regret it. So I think those two things are important to have. And then just generally on applying for medical school as well, I think a lot of different medical schools have different cultures. So I would make sure to explore those too, rather than just exploring maybe ranks of those, to see which one is actually a good fit for your personality.
Okay, so now let's talk a little bit about your careers. So this question is open to everyone. What do you like best about your job? We'll start with Prabhav.
So I think the thing I like the best about my job is that it's a specialty that focuses on quality of life. So we work with a lot of patients that have disabilities. So patients with injuries to their spinal cord, who can often be predominant wheelchair users, or people that have had a brain injury, or people that have had a stroke, or people with musculoskeletal issues. And for all of them, we try to optimize their function and try to help them live the type of life that they want to live, and ensure that they have the best quality of life possible. And I find that really gratifying. So that's probably the aspect of my job I like the most.
Thank you. Hersh, what do you like best about your job?
I think I like best the way how I'm able to help people so significantly, and the way in which I'm able to help them. People come to us during some of the most stressful times of their life, such as when they've been diagnosed with cancer or something like that. And we're able to diagnose them, and then take them to the operating room, and used amazing advanced technologies like robotics and lasers and microscopic camera guided surgery and all sorts of things. And shortly afterwards, they're often cured of their disease, and they're just so grateful, and I just find that so rewarding.
Thank you. Sanjana, what is your favorite part of your job?
There's two things that I really like about neurosurgery. The first thing is that you have a chance to make a very direct impact on a patient's life. For example, I'm at the trauma hospital right now. We have patients that come in that maybe were in a car accident or fell down, and they have some bleeding over their brain. And when they come in, they're completely unresponsive, not talking, but then we can take them to the operating room and do a quick procedure to drain that blood, and they'll wake up in a couple of hours. So I really enjoy that. With surgery, you can have this very direct impact on someone's life that way. And then specific to neurosurgery, I also really like working with patients that are going through some of the most difficult things in their life. A lot of our patients are critically ill, and I like working with families and helping them make, just really devastating decisions about their loved ones sometimes really exciting decisions. But I like being there with patients for that.
That's great. Next question. I know that being a doctor is a very demanding job. So what kinds of personal traits or qualities would serve well for this career or job? And we'll start with Hersh for this one.
Yeah, I think being a doctor comes with a lot of challenges that everyone's aware of. So I think it's really important to be someone who's very driven and focused and passionate about helping people, because those are things that make you a very effective doctor, and they're also things that allow you to persevere with sort of the ups and downs that come along. And that passion is what allows you then to get the reward from helping people and makes you keep going with it.
Thank you. Sanjana, what kinds of qualities and traits would serve well for your specific career?
Yeah, I agree with everything that Hersh said. And I would add, I think a lot of good doctors are also interested in learning a lot. I mean, it seems kind of obvious, but a lot of the times, even past medical school and such, we have to keep up with things and learn things every day. I think there's like everything in medicine, so things are obsolete so quickly that you're always having to do research and keep learning to be the best you can be for your patients. So I think that's an important skill to have too.
Opening this question up to everyone, what does a day in the life look like for your specific role in your specialty? We'll start with Hersh.
So, as a urology resident, most of my days are focused on taking care of patients in the hospital and in the operating room. So I usually get into the hospital somewhere between 5:30 and 6 o'clock, and we check on all of the sort of urology patients who are recovering from surgery or have other urology conditions. And then by 8 o'clock, I'm usually in the operating room, which usually goes the full day until like 6 o'clock, where it can vary anywhere from doing like one big surgery, like removing someone's bladder, or a lot of smaller surgeries like treating kidney stones. And then usually we check on the patients again in the evening, and I'm home by 7 o'clock or so. And I think a lot of that is similar for when I'll be out of residency as well, with the addition of there'll also be days where I'll just be kind of in clinic seeing patients, and that's a more regular sort of schedule of you're in clinic from 8 a.m. to 5 p.m. every day.
Very interesting. Prabhav, what about you? How does your day look?
So one of the things I like about PM&R is that it's pretty varied. So you can have predominantly inpatient work, kind of like what Hersh was referring to, or you could focus more on the outpatient side. As a specialty, it's a little bit more heavily skewed towards outpatient. From what I'm going into, musculoskeletal medicine is almost entirely outpatient. So a typical day will be starting at 8 o'clock. I'll come in and I'll have clinic, and I'll see patients with musculoskeletal issues. Sometimes it'll be athletes, sometimes it'll be older patients with back pain, shoulder issues, knee issues. If there's an injection or some kind of intervention that's needed, we can usually do that in the clinic itself. We can use the ultrasound machine or the X-ray machine to help kind of guide those interventions if they're indicated. And that clinic or procedures will usually go until 5 o'clock, and then I'm home. And then if there's call, then I'll do call. But I would say kind of at this stage of my training, call is not super common. So that's kind of my average day.
Sanjana, what does your day look like?
So I can go over like kind of the structure of neurosurgery. It's a 7-year residency, and you start off as a junior resident. It's very similar to Hersh's day. So I get in around like 5:30 as well. We see our patients, and then either go to the operating room for the rest of the day, or since I'm a junior resident, I'll see new consults that come in, which are new patients coming in through either our emergency department or the trauma bay that need neurosurgery to kind of evaluate them and weigh in on them. And then I'll usually leave around 6 as well. I will say that we do have, we take a lot of call. So we're usually Q3 call. So that means that every third day we do a 24-hour shift. And that's pretty standard throughout our residency. Even our senior residents will be doing like Q3 call, but they don't usually have to stay in the hospital. Since we're in the hospital, we can call them and they can come in if it's necessary. And then as you go through the years, you spend more and more time in the operating room doing more and more complicated cases.
When and how did you choose your specialty? We'll start with Prabhav for this one.
It's a great question. It's something that took me a while to figure out in medical school. I initially was drawn probably to neurology. I was a neuroscience major in undergrad, and that was kind of the closest to what I had learned. And I thought neurology was really cool. I love learning about the brain and the nervous system in general. But what I found was, you make this really cool diagnosis, and then that's kind of it sometimes with neurology. And what I really like to see was I like to see patients get better. I like to see patients improve, and then patients improve their function and live the type of life that they want to do. And I feel like physical medicine and rehabilitation is kind of perfectly suited to sort of take over after someone's either had surgery or someone has made a neurological diagnosis, and then work on them and get them stronger and get them more functional and get them to where they want to be. So it was initially leaning towards neurology and then settled on PM&R.
That's really interesting. Sanjana?
Like what I like about neurosurgery is being able to have that direct impact. And the way I chose this specialty, I think in medical school, people will branch out into 2 points where they're kind of more interested in like medical subspecialties versus surgical. And I think that the people that are interested in surgical do like working with their hands and having that kind of direct impact in the OR, whether that's positive or negative at that time, and working with patients that way. And then specifically to neurosurgery, again, I liked the critical care aspect of, I like the critical care aspect of medicine as well. So I liked working with patients that were acutely ill, and I like working with people with neurologic disease because I think a lot of it is very personal to who they are as people, and I like working with people like that. I will say that if you're considering neurosurgery, one thing to keep in mind is just how critically ill all of our patients are. Now that I've rotated on a few other of the gen surg specialties, I've seen that we have very high acuity of care. So that's something to consider if that's something you're going to enjoy, working with people who are so sick and maybe don't do as well as other specialties. So something to know about yourself.
Thank you. Hersh, tell us a little bit more about your specialty.
Yeah, so I think I decided kind of later on in medical school, I always had an idea that I kind of liked working with my hands, like doing procedures, kind of like Sanjana said. And I found during medical school, during rotations where you kind of go through various departments in the hospital, being in the operating room was like where I got my energy. That's where I felt really alive, despite the kind of long hours and difficulty that you're dealing with there. And so looking into various surgical specialties, I liked what urology had in terms of you're still doing you're doing important surgeries for cancer. You're also doing surgeries where you're improving people's quality of life. I like working with interesting technologies, and urology has a lot of sort of technology aspects to it. And then another thing I kind of considered that was part of it is that out of surgical subspecialties, urology also has an ability for kind of flexibility and lifestyle balance really after residency, not so much during it. And so that sort of more flexibility while still being a surgeon was important to me. So I think those things kind of were important factors.
That's very interesting, and thank you for those insights. I know that becoming a doctor is a large time commitment. So would you choose this field again if you were starting over from, say, high school? I'll open this question up to Hersh.
Yeah, I think I would. I think that initially there are probably like many sort of reasons for doing it that are both internal and external. The external could be what your parents think, what you want your reputation in society to be. It could be money. And what I've realized is that actually none of those external things are important. The only thing that matters is the internal motivations, because that's what, again, like I talked about earlier, is that's what allows you to persevere sometimes during a challenging career path. And so having that internal passion is what makes me want to choose this career all over again.
I know that the lifestyle of a doctor can be very demanding. So how do you manage work-life balance? Sanjana, take the stage.
Yeah, I think this is such an important question. For those of you that are maybe in high school or college, to kind of paint a picture of residency, a lot of the times we're working 80 hours a week, doing things that are extremely stressful the entire time with no weekends off. You miss a lot of holidays, you miss a lot of big events in your life. And then later on you're attending, I mean, it varies by what specialty you're in, but I think that both specifically in neurosurgery, it's still pretty long hours at that point as well, with like not as flexible schedules. But that's why I think it's so incredibly important to establish this early and to like keep valuing it throughout your life. So when you're in college, things are just going to keep getting busier, like every single year, from college to medical school to residency. So I would recommend finding things that bring you joy. It doesn't matter what it is, if it's playing video games or reading books, just something that you do for yourself and not for your applications or anything like that, because those are the things that I think are like truly life-saving when you get to residency, because you'll have some really dark times and some really awful moments when you're tired and you wonder why you did this. But if you have that to come home to and to allow that to be a reset for yourself, it's really important. So personally, how my work life, I'm married now, and then even on my post-call days when we're both so tired and so cranky, we kind of force ourselves to go out, whether it's for like a walk or to go get dinner or something, so that we can get out of our heads and do that. And I also try to work out regularly to just vent all my feelings. So yeah, so I would recommend try to find that balance early and don't put it off and say like, oh, I have to study, I don't have time for this. Like, value yourself and prioritize yourself from now.
Thank you for that advice, Sanjana. This next question is for Prabhav. What advice would you tell your 16-year-old self?
That I guess it's easy to say now that I'm much older than 16, but that everything works out in the end. I think there's a lot of anxiety when you're, 16, you're in high school, you're worried about what college you're going to get to. And then if you're thinking about medicine when you're in college, whether or not you're going to get into medical school, or am I going to get into the right medical school? Obviously, for everyone here, it's worked out really well. I feel really lucky to be able to say that. And I think maybe part of the reason why I got here, and I suspect why a lot of other, the other physicians on this call were able to get here, was probably because we were and are passionate about what we do. So I think if you pick something that you really like doing, that you're passionate about, and that you can start to envision seeing yourself doing for at least your young adult life, we're still relatively young on this call, then I think that can really help you. Just like everyone said, medical school can be challenging at times. Residency can certainly be challenging at times. And I think if you have a good goal and the right motivations for going into medicine, then I think oftentimes it could work out really nicely.
So thank you so much for taking the time out of your busy day to do this interview. You've all had incredible career paths, very inspirational stories. So to end off, tell us about a patient interaction that was very impactful to you. We'll start with Sanjana.
Yeah, I wanted to, I just talked about the neurosurgery schedule, and it can definitely be emotionally and physically draining to be in the hospital for 80 hours a week, every single week. But this is one of the patients that you get these people, a lot of patients that make it all worth it and kind of re-energize you. So we had this lady who was 80 years old and had been hit by a car. And from that, she had a lot of blood over her head. And when she first came to us, a lot of us were unsure how if she was going to survive this, because she was 80 and at this point she was not moving at all, not answering any questions. But we took her to the operating room and were able to remove a part of her skull and then wash out all of that blood. And, she came back to our ICU, and then 3 days later, she again had bleeding over her head. We took her back to the operating room, took that blood out again. And at this point, we were just so unsure about how she was going to do because of all of these complications. But, we kept her in the ICU. We kept close watch on her, tried to maximize everything we could do for her. And then I remember 2 weeks later, when a lot of us had thought that she wasn't going to wake up, all of a sudden she woke up, and we were like holding up whiteboards for her since she wasn't able to talk because she had a breathing tube in. And all of a sudden she just started correcting someone's French that they had written on the whiteboard. And then from then she just made this amazing recovery. And this patient only sits with me because a few months later, her daughter sent me a few pictures of her at her grandson's wedding. And I think that sometimes we forget that all of these patients have these incredible lives outside of the hospital too. And this wasn't just a patient, this was an entire person who's able to have all of these experiences now because of what we did. And, that these moments can give you like so much energy throughout your life. And I remember all of my patients like that. So I think that's like a really beautiful thing of medicine, to be a part of that. And yeah, so that patient story has sat with me.
Wow, that's incredible. Prabhav, would you mind going next?
Yeah, not at all. So one that sits with me is probably more from when I was an earlier resident doing more inpatient work. So there was this young guy that came in. He was in a motor vehicle accident, and he was paralyzed kind of from the waist down. He had been stabilized by some very wonderful neurosurgeons at Northwestern, and then he came to our rehab hospital, and he was really demoralized because he was, an athlete before all of this, and he was unable to walk, unable to take care of himself. And I was the resident that was kind of assigned to his case, and I spent a long time with him. He spent maybe a month in our rehab hospital, and he was doing physical therapy, and I heard everyone sort of clapping one day in the rehab gym. So I went over, I wanted to see what all the commotion was about. And he was standing up in the parallel bars. He had some braces on, and he was taking his first steps that he had taken in a month. And he was so excited. Everyone was excited. Everyone was clapping, people were recording it. And, it was really inspirational. He did a lot of the hard work, and we were there to help kind of guide him and make sure that medically he was stable. But, it was all on him, and kind of like the whole team, right? There was the physical therapist, the medical team, the occupational therapist, and everyone sort of came together to help this guy start walking. And that one will sit with me for sure. That was really cool.
Wow, that's really amazing, because on our neurosurgery service, people leave so banged up sometimes from the hospital. So that's so cool to hear about that side of the process too, where you're getting these people back to living their lives. And yeah, my patient went to extensive rehab after as well to get there. So that's really
Wow, it's cool to see how your two roles are so intertwined. Hersh, take the stage.
So a patient story that kind of, comes to mind and was a rewarding moment for me was early in residency. I had only been a doctor for a year, and I was covering this kind of satellite hospital where I was the only urology doctor around, me with all of my 1 year of training. And this patient came in with what a lot of different, more experienced doctors had seen, and kind of diagnosed him with a sort of minor skin infection that they said would just get better with antibiotics. And like the surgery team thought that, the infectious disease doctors thought that, the radiologist thought that, all of his labs kind of pointed to that. But I evaluated this patient and something was just kind of off to me, and it didn't really fit for me. And I suspected he had this much more severe condition called necrotizing fasciitis. And it was tough there as like this inexperienced doctor to stand up to all these other people and say, I think you're wrong, and I think we need to take this patient to the operating room. But that's what I did. I convinced the patient and his family and all these other doctors to go to the operating room, join my team there. And when we did the operation, we found out that I turned out to be right. And probably if we hadn't gone to the operating room, the patient would have died. So it was just a really rewarding experience. It felt like a culmination of like all of my medical school training and all of the sort of long hours I put in to be able to form that judgment. And afterwards, the patient and his family was just so thankful for basically saving his life. So that was a really memorable experience for me.
Wow, that's an incredible experience. Once again, thank you so much for taking the time to do this interview, doctors.